Welcome back to Face to Face. I'm Jon Ralston. We're talking about the dispute among Democrats regarding Senate Majority Leader Harry Reid's handling of the health care reform debate. Joining me to talk about it, liberal blogger Hugh Jackson. He's accused Senator Reid of being too non-committal on the public option. And also with us, Erin Neff from the group Progressives for Reid. Welcome back to the program, both of you. You know, I said that you accused him of being too non-committal. That's actually one of the more kind things that you've said about the Senate Majority Leader. Let me show you what you wrote recently, but predicting what Reid's going to do with regard to health care reform, Mr. Jackson. Reid's decision will not be based on what reform would be best for the country or on whether he can get his questionably necessary 60 votes. Instead, Reid's actions will hinge on a callous calculation of what is in his own individual political best interest as he sees it, based on his keen sense of an electorate that he was last in touch with, maybe 1998. With luck, the opportunist hackneyed political judgment will just happen to coincide with good public policy. I put the odds at about 50-50. This is not new for you, really. I mean, you are constantly frustrated by what you see as Harry Reid's willingness to compromise, aren't you?
Well, you know, actually, it's not just him. In some ways, I think that Harry Reid and the Beltway Democrats have mirrored each other over the last, well, most of the last 10 or 15 years. And sometimes that has been good on some issues, but a lot of times it has led to things like apologetic defensiveness against Republican policies, caving to the Bush administration through much of it. Obviously, the acme or nadir of that, if you will, was when the Democrats had the majority of the Senate, everyone forgets this, and still gave Bush a blank check to go to Iraq. I mean, it is not just this issue that leads me to the conclusion that I wrote there.
All politicians obviously calculate politics when they're making a decision to some extent, to a lesser or a greater extent. You seem to fear that Harry Reid is not even going to consider what you and probably Adam Green would agree is best for the health care reform, but he's going to consider only his re-election prospects in 2010.
I think that is, as you suggest, a safe conclusion to draw with regard to any politician. You know, as Mencken famously said, there's only one way to look at a politician, and that's down. Now, I would like to think that he will do the right thing, but I don't think that people who are more interested in seeing transformative, meaningful health care passed, of which I count myself as one, than Harry Reid's re-election, I'm more interested in the former than the latter. I don't think that we can just blithely trust the senator to do the right thing.
Erin Neff has a different view, and she also wrote something about Harry Reid on her blog. Let me show you, Ms. Neff, what you had to write. It's certainly easier to slam Senator Harry Reid like the right-wingers than it is to champion him for his nearly impossible job hurting conservative Democrats in his caucus. But Reid has been consistent that he wants a public option in health care reform. While the magical 60 votes needed for cloture is a monstrous task, can you say Ben Nelson? Reid has pledged to do what he can to make real health care reform happen. Where is the opinionated, knock 'em dead Erin Neff, who used to write that column? I mean, you're letting Harry Reid off the hook here, aren't you?
Well, look, if Harry Reid is after his own political best interests, as Hugh suggests, then he would push strongly for a public option. Americans want it, Nevadans want it. Adams' poll shows the majority of Nevadans want it. So if it is in the best interest to get it done, and if it is in his own political best interest to do so, then it would happen. You know as well as I do, this is about process. This is about the Senate, the quirkiness of the Senate. And,
but this is what drives guys like Hugh Jackson crazy, and Adam Green. They say, come on, the right thing to do is to pass what he calls transformative health care reform. The Democrats control both houses of the legislature. They have the presidency. Get it done. Is that completely unrealistic?
Well, look, I mean, a lot of mistakes have been made this year with respect to health care reform, some of which came from the White House. You can't put this all on Harry Reid, but
it's all on him now, though.
I think it is all on him now, and I think whatever eventually comes out should be all on Harry Reid, and I think at that point we should hold him accountable for what passes. I think this process has to go through. I think this not only has to go to the Senate, go back to the House and get better and stronger. If we really wanted to be honest about health care reform and what is the best route to comprehensive health care reform, I think Hugh and I are on the same page. It's a single-payer system. It's not this public option we're talking about now.
That's never going to happen, at least not in this congressional session.
Which is my point about what is practical and what is possible.
We're going to come back and talk more about that with who's the real progressive here. Do we have a reasonable progressive and a pie-in-the-sky progressive? We're going to talk more about that when Face to Face returns.
watching Face to Face with Jon Ralston, a program presented in partnership with the Las Vegas Sun, Cox Communications, and KLAS TV.